Well, I'm looking forward to a lively discussion. I'm excited about being here, and I definitely look forward to audience participation. As they make the adjustments, I will probably ask our panelists maybe to begin to approach the front, and we will begin to ask some key questions.
The question that Peter's posed, it's pretty simple for us in public health. We were very excited about a lot of aspects of the healthcare reform plan, the addition of about 30 million people into insurance, which was a great thing and is a great thing. But the number one thing for us in our world is what will the prevention strategies that will be funded and supported as part of the healthcare plan turn out to be? And that is, what are those additional things outside of what you do sort of in the traditional doctor's office setting? What other elements will be added, both from a sort of public health agency prevention standpoint, but also what Jean had mentioned a little bit earlier about some of the things that she's been able to do with some of her new support, is that team approach to caring for chronic disease. So again, not just that typical doctor's office interview and discussion, but having other experts, other resources in the mix to address the chronic illnesses of patients that come in the door. So that is support after the doctor's visit is over.
Through community health centers. If you look at the cost of care in this country, we get like 35th in outcomes, and we spend double the amount of money. And part of that is that historically there's not been the emphasis on primary care. So folks enter the care system through the emergency room or at a time where they've neglected their health, neglected prevention for a long period of time. And I think the Congress is really trying to struggle with how do we get those costs down. Well, every other industrialized country, how do they keep their citizens healthy? Through a network of community health.
Afford or just haven't had access to. But access to care is a great component. And to kind of dovetail off of Matt's comments, the health center model of care is not just going to your doctor's office and out the door. It's much more holistic, it's coordinated, it's comprehensive. It is the model that we need to be moving forward to as we move down the road. I think from how will individuals who gain coverage, how that change moving forward, especially for health centers' uninsured patient population, they're going to have much more choice once they gain coverage. And I have complete confidence that our uninsured patient population, as they gain Medicaid coverage or coverage through the exchanges, that they will continue to use the health centers as their healthcare home, because the quality of care in community health centers across the state I would put up against any non-FQHC provider. It's excellent. It would also say, and this is something that really isn't as sexy, it doesn't make the headlines, the health center program received permanent reauthorization in the health reform bill, which is amazing. It's, you know, Social Security, Medicaid, those are permanently reauthorized programs, and now you can add health centers to the list. There are very few permanently authorized programs in the federal government. So
how are we going to ramp up the number of primary care providers who are available to them?
There is a recognition that we're not going to have the primary care base if everyone that goes through medical school then goes into a specialty in an effort to pay down their medical school debt. I think there's going to be more and more. Julie probably knows the numbers, so I'll turn it over to her. But there's a huge emphasis in